The World Health Organization's vaccine alliance, known as COVAX, says more than 24 countries are yet to receive any inoculations for COVID-19. The group is blaming a rise in vaccine nationalism, which has seen wealthy economies hoard much of global supplies, leaving little for everyone else. Paolo Montecillo has more.
In his Easter sermon, Pope Francis called on world leaders to act as good Samaritans and share vaccines with their neighbors.
I urge the entire international community in the spirit of global responsibility to commit to overcoming delays in the distribution of vaccines and to facilitate their distribution, especially in the poorest countries.
Priests and nuns who live in Vatican City have already received their inoculations. But the World Health Organization's vaccine initiative says there's a growing divide between those who have shots and the have-nots. According to the Gavi Vaccine Alliance, only 84 countries have started getting jabs into people's arms. Its immediate goal is to get vaccines in 100 countries in the next few weeks. 30 countries have not started immunization programs, mainly due to supply constraints. Bloomberg's vaccine tracker shows 10 nations, led by the US and China, have received nearly 90% of the world's vaccine doses. The WHO has asked wealthy nations for 10 million doses to help as many as 20 countries.
I also requested manufacturers to help ensure that the countries that step up can rapidly donate those doses. This challenge has been heard, but we're yet to receive commitments for these doses.
Meanwhile, some nations are getting creative in their desperation.
Venezuela tiene los barcos petroleros.
Venezuela has the oil tankers. It has the clients to buy oil from us, and it would dedicate part of its production to guarantee all the vaccines that Venezuela needs. Oil for vaccines.
Todas las vacunas que necesita Venezuela.
The WHO's Vaccine Alliance says it's placed orders for 2 billion shots for countries that can't produce their own vaccines or can't afford to buy them. But those doses won't be available until the second half of the year. That would give rich nations a head start on resurrecting their economies while leaving much of the emerging world behind. Paolo Montecillo, TRT World.
For more, let's go to Dr. Muhammad Munir. He's a virologist at the University of Lancaster in the UK. As always, pleasure to have you on the show. So the COVAX program had hoped, or rather planned, to begin inoculations in all countries by April 7th. That deadline is obviously going to be missed now. How important is it to make sure that there are no further delays in this rollout?
Well, this COVAX facility that was set up around a year before has a very ambitious aim, and that is to provide 20% of the population of the low and middle income countries, around 192 countries, to provide this vaccine by the end of this year, which seems to be very challenging, and primarily because of a lack of funds, lack of the vaccine itself, because most of the vaccine manufacturing capabilities has been scooped by developed nations. For example, at the moment, the COVAX facility is waiting for $6.2 billion US dollar to meet this demand. And also, one of the major problem, Mubin, that I see with the COVAX facility is that they provide the doses to the country up till the airport, but then from the airport to the arm of the person is the responsibility of the country, and most of those countries not have that infrastructure for the cold chain maintenance, for training of the staff, and also for the syringes and other stuff that is required for the vaccination. So all in all, it is certainly a very challenging task, but the failure of the COVAX is the failure of the vaccine in the developing countries.
Now, Dr. Munir, you've said this many times. You've heard other health professionals also say that no one is safe until everyone is safe. Can you please explain to us why are other populations that haven't been vaccinated still a risk to populations that have been vaccinated?
Mubin, this is the most important aspect because what we are looking into is a transboundary infection, the infection that does not respect the border, does not respect of any sort whatsoever you think. What is respect is that you are vaccinated or no. If people are not vaccinated, they are very susceptible to the infection. So any change in the social behavior going to bring the infection up. And one of my major concern, Mubin, here is that you can imagine some people in the community are either recovered from the infection or are having the vaccine. But then you have half of the population, for example, in the UK, that is not yet vaccinated. That means that you have a very good mixture of people who are vaccinated and non-vaccinated. And this virus is then find an ideal environment to mutate. And what we're going to see in the long term is that the developed nation would have a high level of immunity. Developing nation wouldn't have the immunity. More and more mutant would start to emerge. And those mutant can escape the immunity and make the whole vaccination campaign undone even in the developed nation.
Very quickly, if I could ask you, some countries have been asking these pharma companies to give up patents on humanitarian grounds. Is that something that could help speed up the rollout?
Oh yes, absolutely. Majority of the vaccines, those are up in the rollout stage. They are the ones those are protected by the IPs, and that is limiting factor for many of the countries who have the capability to manufacture vaccine. They can't do it because these are protected. So I think at this moment on the humanitarian grounding, all the IP, the patent, and all of those things need to be put aside. Business need to put aside. What we need to think is about the public health and the humanity.
Thank you so much, as always. Appreciate your feedback here on Money Talks.